This 22nd day of January. Joining us at the desk is Crystal Glazebrook-Hurley. She's the RN chest pain coordinator for Iowa Methodist Medical Center here in downtown Des Moines. And on Jackie's right is David Keenan. He's the manager for Methodist West ER. And we're here to talk about chest pains. And I'm sure there's a lot of people that will tell you stories about, oh, if you have chest pains, here's what you need to do. You need to take an aspirin. You need to stand on your head. You need all types of things. And being from the ER side of things, you guys probably know the correct things to do if chest pain is striking someone. So what are some of the first things?
So the symptoms that you want to know about are obviously the chest pain, but some people have more of a squeezing, heavy feeling. Those are basically the symptoms you want to look for, along with nausea, vomiting, dizziness, lightheaded, shortness of breath, jaw pain, pain in your left arm, sometimes the right arm. It radiates to your back. All those symptoms are very good symptoms to be aware of and to come to the ER.
Now, chest pains to me seems pretty broad. Are we focusing on you're having a heart attack, you're having some sort of bigger issue, or just chest pains in general can cause damage to your body?
Well, chest pain is an indicator that your heart is not getting the blood supply that it needs. So it's telling you that something is wrong. We found that heart disease is alive and well in the city of Des Moines. We see a growing number of people that are younger and younger all the time that are coming in with those typical signs and symptoms of chest pain, and they feel, I'm young, this can't be happening to me, but in fact they do have heart disease, and it can be something that's genetically inherited. You know, you inherit it from your mom or dad, or it's because of their lifestyle.
As I say, why is this affecting people younger and younger now?
I think a lot of it has to do with our lack of activity. I think our lack of our changes in our diet, I think, has a huge deterrent or effect on creating heart disease. I think a lot of things in our sedentary lifestyle are causing more and more younger people. You know, when we were little, we would play till dark.
Yes, we did.
And when the street lights came on, we had to come home. Now, people are in front of their video games all day long. Adults now, with the, you know, it's just a change in our behavior of activity. I think it's changing.
Now, you mentioned food here and what we're consuming and things like that. But what about someone who said, "Oh, I thought I had indigestion"? Is that one of the signs of what they consider chest pain?
It is, and women show signs and symptoms differently, or demonstrate them and recognize them differently than men do, and women are deceiving at times. So yeah, people think it's something else. You know, I was raking leaves all day and I have shoulder pain now because, oh, it must be because I overdid it today, when in fact it's your heart talking to you.
Yeah. One thing we wanted to talk about is if you want to learn more about chest pain, we're going to have a lunch and learn at UnityPoint Health. It's going to be February 13th and at 11:30, and we provide lunch. So why not come and learn a little bit and get a free lunch?
Now, which location is this going to be at?
It's going to be at the downtown center at Methodist. So yeah, please come.
We're going to have a panel of survivors at this lunch and learn. So we can put a face to those that have demonstrated the same history, the same problems, and you know, really put a face to that, as opposed to, you know, it's important for us to see that, I think.
Now, you're saying women react to it a little bit differently.
They do.
Crystal, can you kind of describe what a woman might feel? Or I mean, we're known for being multitaskers. We have a lot of things going on, so we almost ignore. It's like, well, I don't have time for this right now. But you're saying we need to kind of look in and listen to what's happening with our body.
Sometimes women don't actually have the chest pain. They'll just have the nausea and the vomiting, and what you were talking about earlier, just that indigestion, where they think, well, it's just reflux, and they'll take like a Zantac or a Pepcid, and they'll just go back to their daily life, when really they are having the onset of a heart attack. So just knowing those symptoms right away and going to see a regular doctor, coming to see us.
Now, is there something that somebody can do in case they are feeling like this, and say, no, is there anything else they can double check, saying, you know, this might be, and in fact maybe it is indigestion or acid reflux, but is there anything else that they can check just to say this does not look right, or is it, you know,
I wish there was.
There's not.
That is something that I wish technology could really improve on, learning those things at home. But no, coming to the ER, don't driving yourself in your own car, calling 911, getting to our ER as quickly as possible.
Now, is there a test they can take? Because maybe, you know, they go to their family doctor and it's like, hey, I'm having indigestion, I'm throwing up, and they're like, oh, you have the stomach flu, here, take this pill. Or is there, if they hear those symptoms, they know, well, we better check a couple other things as well.
We like to get an EKG, and our goal is to do that less than 10 minutes from the time you reach our door. So we get an EKG, which is just a bunch of electrodes on your chest, and then we look at the activity of your heart.
Little sticky pads.
Yeah, exactly. And that right away tells us if you're having a heart attack.
Really?
Yeah.
Are there tests you can do before you get to that point? Like maybe you know you have it in your family history, or you just want to stay on top of what's happening with your body. Maybe you haven't made the best choices in life. It's like, you know what, I just want to make sure everything's going all right. Are there tests you can do before something might happen?
Well, oftentimes, in a personal experience of mine, I inherited heart disease, and it's important to be aware of your cholesterol levels, your triglyceride levels, all those things that you need to know based on your blood values, which you can go to your clinic, your physician, and say, hey, why don't you run, it's called a lipid panel. I'm a little concerned. My dad died early of heart disease, and I really want to know where I'm at. Do I need to do some preventative things now? Really change my diet now. Change my activity now, and try to stay off those things or reduce those risk factors. Absolutely. Connecting to a good primary care physician, your personal physician, and be aware of those things in your life that can affect you into what we say are our golden years. You know, we want to enjoy them. So yeah, absolutely.
And of course they can help you out with that with Methodist or UnityPoint, but of course they can also help by just going and hanging out and have a free lunch as well.
That's right.
They can.
So give us the details once again on this luncheon coming up.
Yep, so February 13th is when we're going to have it, and it's going to be at 11:30. And all we ask is that you RSVP and please come for a free lunch.
Wonderful. UnityPoint.org for more details.
A lot of people interested in that. Perfect. Yeah, and again, you mentioned about making sure you stay on top of your cholesterol, and we got off of it for a while. And also want to make sure you pay attention to what's happening to other members of your family, too. Because even if it's not affecting you, and if it affects another member of your family, that could be pointing towards you eventually.
Yeah.
Absolutely.
Okay,
Well,
wonderful.
thank you so much for joining us
Thank
this
you for
morning.
having us.
Thank you. Thank you.
We'll be right back. Totally serious news coming up next, including a very unique way you can wish somebody a happy birthday involving a celebrity. We're going to wish Jackie a happy birthday in a couple of days via a celebrity next on Great Day.